The reconciliation law, otherwise known as OBA, is primarily a tax law, and it extends, its main purpose is to extend 2017 tax reductions that were temporary and make them permanent. And the value of those tax cuts is $5.3 trillion. Another component of this is that there was an increase in spending for defense and immigration enforcement, and there are some eliminations of some energy initiatives and some changes to higher education funding. I am not an expert in those first four categories. I can make my way around Medicaid, and I can sort of make my way around SNAP, which is food stamps, supplemental nutritional assistance programs. The reductions to Medicaid for the entire country nationally total nearly $1 trillion. It's $990 billion over the 10-year forecast for the statute. The reductions for SNAP is roughly about $180 billion, which is about 20% of its typical budget, or spend, I should say. When we talk about health access, there are reductions in spending to Medicare, and there are reductions in spending to Medicaid. Most of the reductions in spending to Medicare make it harder for very low-income Medicare enrollees to access this cool program called Medicare Savings, which helps them pay their premiums and their cost sharing for their Medicare benefits. Those cuts also eliminate coverage for people who are lawful immigrants who have been eligible to receive Medicare benefits. And there are some general projections from the Congressional Budget Office which suggest that the deficit that the bill creates could put as much pressure as $490 billion worth of financial pressure on Medicare that would have to be cut in the intermediate years between 2027 and 2034. And then in Medicaid, there are similar approaches to how the funding is reduced. The reductions in funding from Medicaid are primarily through frustrating enrollment by imposing work requirements, by imposing more frequent eligibility checks, for imposing additional cost sharing on the participants. It ends Medicaid coverage for many legally present immigrant populations. And then it really compromises, especially after 27 and 28, state financing options and provider payments.